Well, that is a very hot research area, this vitamin D. And it is quite clear that the majority of Americans, and even a higher percentage if we live in the northern part of the United States, are quite short on vitamin D. We thought just a few years ago, I thought that pretty much everyone did, that vitamin D was mainly related to osteoporosis and fracture risk. But what's become apparent now is that virtually every organ in the body has receptors for vitamin D, meaning that vitamin D has a role there, including the breast and colon and many other sites where cancer is common. And we have evidence now that in quite a few studies that higher vitamin D levels in the blood predict lower risk of colon cancer. We've looked at this for breast cancer and seen a modestly lower risk of breast cancer as well, but we need more studies to replicate that to be more confident. So this is a very active area of research. Now, for people who already have a cancer, is there a role for getting for higher vitamin D intakes, perhaps improving the prognosis? We just don't have the data on that yet. That's something that we and others are starting to look at now. There are a few hints that people who in the Scandinavian countries who had their breast cancer diagnosed during the summertime in early fall when the blood vitamin D levels are higher had a better prognosis. So that's just an indirect hint, but this is clearly a very important area to pursue. I think actually on the basis even just of the osteoporosis evidence that it's a good idea for most people to be taking about 1,000 IUs of vitamin D. And I think their evidence is probably that we're in a couple of years want to make that 2,000 or 3,000 IUs of vitamin D, because even 1,000 doesn't bring a lot of people up to the levels that look like are optimal, which is 35 nanograms per liter. One thing, if someone thinks at risk of low vitamin D, you can do two things. Either just take some extra vitamin D, or now the clinical tests are available, so you can go to your physician and ask to have your blood vitamin D level checked. And physicians are all of a sudden becoming aware, now that they're measuring it, that there's a huge epidemic of low vitamin D or vitamin D deficiency.
Thanks. I think it says something to me that question from the audience, we have the world's expert to answer that question here, which is it's extremely gratifying. Well, the question of sun exposure comes up, and I just, obviously there's a yin-yang with that in terms of skin aging and skin cancer. And so, that is well, Walt, you want to make a comment? Okay.
Just a quick comment, because that question comes up a lot. Should I get it from a pill or from the sun? If you are really careful and go out in the sun for about 15 minutes a day during the middle of the day, expose most of your skin, then you can probably get adequate vitamin D without very much increasing your cancer risk. But we have hard enough time getting people to take one pill a day. And we have to remember also at this latitude, during 3 or 4 months of the winter, you can go running around nude in Central Park for an hour, and you won't make any vitamin D, because the sun actually, it's the same UV rays that cause skin cancer are what activate vitamin D in the skin. So there's, if you're not getting enough sun to tan, you're also not getting enough sun to make vitamin D. So it's possible to get it from the sun if you're really careful, really diligent. But most of us live lives that are just where that doesn't work very well. And so from a practical standpoint, I think for most of us, taking a supplement is probably going to be better.